My name is Donna Skota. I'm the Health Commissioner for Summit County, and I'd like to welcome you to 1867 West Market Street. It is our new home, and we're proud of it. I've been in this position, thank you. I've been the Health Commissioner, I think, for 4 weeks now, but I was the Assistant Health Commissioner under Jean Nixon. I'd like to take a few minutes and thank our board members. They're right here. That came tonight because they work just as hard as we do for Summit County to keep everyone healthy. The mission, I think most of you know, the mission of a health department is through policies, programs, advocacy. We try to keep people healthy in healthy environments. We all know that's not the easiest job. Through all of our programs, we want equal access for everyone. We want everyone to be able to take advantage of everything, regardless of where you live or who you are. One of the projects, they asked me to speak just a few minutes, one of the projects we've been involved in for quite a while is for about the last 13 years is the Quality of Life Project, where on behalf of the Social Services Advisory Board and the County Executive, we have tracked data, we have looked at trends, we have done any number of reports to report back to the community the health status of Summit County. And we've tried to improve programming through that. Again, a dedicated group of folks who come together on a volunteer basis just trying to improve health. An example of that, again, carrying on, is this year, we're very proud, just June 29th, we were able to open a fixed-site dental clinic because it's been identified that it is one of the greatest unmet needs in Summit County is dental care, regardless of who you are. Seniors suffer, children suffer, individuals without any kind of health coverage suffer. We also, in response with our partner, Alcohol, Drug, Mental Health, in response to the increase in opiate overdose, we are now a naloxone dosing or distribution site where we're actually able to provide naloxone to families and drug users to help prevent that accidental overdose if in fact, and help maybe keep them alive so that they can seek the treatment to recover. The other thing that we're looking into, and again in response to community needs, we've seen a huge increase in Hep C, hepatitis C, so we're now looking at a needle exchange program as well. We're investigating that. So the whole idea of this is to keep our pulse on the community and look and see where we can make the most impact with limited resources. And that's tough for all of us because nobody has enough money to do what they want to do. So you must imagine when we got the call, we were very excited to be able to host this meeting and to bring together this group of folks to talk about health in Summit County. And you have to know Summit County is kind of a very close-knit community that works well together, and all of us saw each other eat today at 5 meetings already. Okay, so it's like we've eaten breakfast together, lunch, and now we're going to have dinner snacks. Okay, we've all seen each other all day because we do work closely together. But I would like to thank you all for coming personally. On behalf of the board, our staff, we want to thank you for coming and participating in this conversation. You could be home taking a walk, doing something healthy, but instead you came here to give us your ideas, and we appreciate that. And it's with great pleasure right now I am going to introduce Kit Jensen. She is the Chief Operating Officer for IdeaStream.
Thank you all for being here. And Donna, for 4 weeks on the job, I always want to partner with Donna. If she can bring all of you together at any call, that is just fabulous. We are very pleased to be able to partner with the Summit County Public Health for today's discussion. So thank you for making the time. I know it's a very nice day, and we'll try to make this efficient and impactful, and I can tell you from the IdeaStream point of view, it is going to help set a programming agenda, which hopefully you will see on radio and television in the next year. For those of you who do not know what IdeaStream is, it's Northeast Ohio's multiple media public service organization. Now, some of you may watch or know some of our stations, WVIZ PBS, 90.3 WCPN, the NPR station, or classical WCLV 104.9. Now, we've provided annual reports. It's the blue cover. And if you open it up, and on the left-hand side, there is, it describes the 8 different educational and public service media programs of IdeaStream. And what we try to do is, for Northeast Ohio, bring the assets of media together to tackle community issues, education, citizenship, and to celebrate the arts. So this is this conversation today is an important one for us. This kind of conversation is part of a project that we call the Listening Project, which has been ongoing since 2001. Some of you I have met in the room before. I've worked with you before on health programming, and thank you for returning today to help us. Last year's Listening Project report is also at your table. It's the one that shows all those people at a bar. Now, why would we be at a bar? Because that's where a lot of people are. What we do is we have a series of forums and surveys, and at the end of every year, we aggregate what are the top assets of the region, what are the top challenges of the region, and then we focus our programming and our produced content on reflecting that, which is important to the community. And health information is a very major emphasis for IdeaStream. We are so pleased to have found the ability to provide over 5 years' worth of continuous health and information programming under the Be Well title. You are going to be help inform that. In the back of the room, we have a variety of managers, producers, reporters, and staff of IdeaStream. We have a great crew here today, very experienced, and we are recording. So I want you to please check your cell phones and put them on vibrate or turn them off. We are recording this. We will create a report. We will send you the report. We will put this entire recorded conversation on a website. We will send you the link, and we'll return for further conversations with you. And so I really do appreciate, again, your full participation today. So to facilitate today's meeting, let me introduce Mike Shafrenko, who is our Manager of Community Engagement, Web, and Social Media for IdeaStream. Mike?
Thank you, Kid. Good afternoon. Sorry, my back's going to be too. I'll be sure to turn back to you. So as Kit mentioned, the conversation today will really inform a lot of the health programming and content that we create and produce at IdeaStream. So we're really looking forward to hearing from all of you. In lieu of introductions, because there's so many of us, it'll take us literally half an hour just to get through all of you. You have in front of you an attendee list. So you can get a sense, obviously not everyone is here, but most of the folks that registered are. So you kind of get a sense and a feel for who's here. And of course, we have folks not just from Summit County, but Portage County and Medina County as well. So thank you to all of you who have come here today. Additionally, on the third sheet of that attendee list is a worksheet, which really just includes the questions that I'm going to ask. So in case it's a mystery as to what are we talking about today, you can go ahead and take a look. And we invite you to jot your thoughts down, both for 2 reasons. One, so that you can keep your comments relatively brief, because we have a lot of people today. We want to hear from all of you. And the other reason is, well, we're going to pick up these sheets after the conversation today. So if there's comments you weren't able to make or you didn't feel comfortable making in front of the group, jot them down there, and we'll make sure to grab them before we leave today and include any comments you make in the final report. And if you could do us a favor, if you could either circle your name on the attendee list in front of you or write your name on the worksheet so we know who said it, we'd appreciate that. So we're really going to go through 3 big questions. We have a little bit over an hour to get through them. The first is, what are the top health-related issues in our community? And we want to hear from all of you, and we'll have a conversation about that for about 30 minutes or so. The second question is, what's being done to address these issues? And is there a common community health agenda in Summit County, but also Medina and Portage counties as well? Is there a common understanding of what the issues are and how we're addressing them, or something else going on? So we want to hear about that. And the last question is, what can we, IdeaStream, as a public media, public service organization, do to help with some of these issues and opportunities as they relate to health? So again, we produce content, we report on health topics. So what can we do to help to advance some of these things going on in Summit, Portage, and Medina counties? Sound good? All right. So let's get started. And one other thing, when you first speak, if you could state your name and the organization you're with, just so the group kind of knows, that'd be great. And then when you speak again, you don't have to keep doing that. Just the first time you speak, state your name and what organization you're representing. So with that, we'll get started. What is the top health, or what are the top health-related issues in our community? Who wants to go first?
I'll be brief and start. I'm Sharon Gefkin. I'm with Summit County Children's Services. I think we have many. A few jump right out at me. One is infant mortality and the disproportionality that we see. And I'm glad we can talk about number 2 and what's being done, because there are some things happening. And then opiate addiction and substance abuse in general is another major concern.
So infant mortality, opiate addiction, what else? Yeah?
Down here at Summit County Public Health, obesity. Just becoming a larger society for lots of different reasons.
Mm-hmm.
Can you repeat what she said?
She said obesity.
Okay, sorry.
So obesity, infant mortality, and you don't have, and you can say a little, you can expand on your answers. It doesn't have to be one word. So we have infant mortality, obesity, opiate addiction.
Lisa Rittenauer, University of Akron, health literacy. If our community doesn't know how to interpret what a healthcare provider is telling them, they cannot make informed decisions.
Tom Tulisiak, President of Medina Hospital, Cleveland Clinic Hospital. So to expand a little bit on the obesity issue, that's part of the health and wellness and disease prevention aspect of things, the whole gamut of that, but also of critical need. I think most people in all the surrounding counties, whether it be Cuyahoga County, Summit County, Portage, Medina, et cetera, are mental health care needs. There's a clear lack of psychiatric health care professionals as well as psychiatric beds in northeastern Ohio, which is really a critical problem. It's amazing right now that all the mental health and psychiatric beds are tight. There is no access pretty much right now, and this is a low time of the year. That's a big concern.
Okay. Yes.
Hi, Sheila Williams. I sit on the board. The obesity is a big issue, I think, but I think even more so is the fact that children are going hungry. And we look at these young adults, and they are obese. They're taking in thousands of empty calories that are causing obesity plus the health problems. So I think this urbanization of the farming, health, I know we do a lot of talking here at the board with food, that has an impact and possibly moving it at another step. But that is the bigger issue to me, is that children are hungry. And now we're seeing seniors hungry. And that's something that's new in the last couple of months in talking with the people here. So I think those two issues impact what we're getting, and hunger leads to mental problems. The obesity leads to the sugar, the high blood pressure, the different health issues that we're seeing more and more.
Why do you think there's an increase in seniors?
I think the isolation.
Hunger.
I think that they think that they're eating and they're not. They're not interacting. If they're not active, you can feel as though you're eating. My girlfriend told me she spoke to a woman last night that was 94, who told her she integrated Warrensville in 1964 and gave her the whole historical view of Warrensville in the evening. And she said, I was amazed. She says, but she sat on 4 or 5 committees. She was very active. She was in and out the house. Well, you have a lot of seniors that are not. And that's where the Meals on Wheels and the different things that we have come into play to check on them. We're feeding them, but we're also checking on them.
John Trump with Summit Developmental Disabilities. We see the huge rise in the number of people diagnosed with autism as having a community impact. Nationally now, they're identifying that that rate is in the range of 1 in 67 children born, and lots of theories on why that increased diagnosis, or the fact that it's now viewed as more of a spectrum type of disability. But the impact on schools, eventually employment opportunities, independent living for people that have been diagnosed with autism, I think flies below the radar sometimes in terms of community health, and certainly something that we at the DD board pay close attention to.
I'm Liz Flaker from Open M Free Clinic. I think the major thing we contend with in our clinic is upstream versus downstream healthcare. By the time patients come to our clinic, we are just fighting against the downstream. If they could come to us a little sooner, we would be able to get some more preventative measures into place instead of trying to catch up and get them healthy.
Could you explain that a little more?
Most patients
upstream,
come,
downstream?
right. The upstream, in my thinking, is where you come in and you know, maybe a recent college grad, you know, you're happy-go-lucky in life. You're deciding to take care of yourself. So you come in, you maybe go to a family doctor, you have insurance, you're able to go take care of yourself. You find out, oh, you're hypothyroid. Oh, okay, I'll get on my thyroid medicine, I'll be good to go. A typical patient that may come into Open M has not had health insurance maybe for a number of months, years, whatever. They finally find out about us, get hooked into our system. They come to us, they've already got hypothyroidism, they've already got diabetes, they've already got hypertension, and they've already got on their way to obesity. So we're fighting against multiple factors as opposed to getting them in when they're healthy. We're getting them in when they're pretty well on their way to fighting some chronic illnesses.
Karen Herdlicka from Mature Services. Getting back to the seniors, one of the things I was here not too long ago for a meeting on adult protective services, which is really an unfunded mandate apparently. And Summit County's done a very good job of bringing resources together to work together, but sometimes it's the case management. And when you talk about the hunger, people knowing, and also generationally, those folks don't want to take a helping hand and that, but it's just getting services coordinated for the person so that they can be healthy. And exactly what you were saying is preventatively getting things in there to help them so they're not coming to the hospital. I also sat a couple years ago on a committee with the ambulances. A lot of times the ambulances were going, they got a call, they would come to the home, but it really had to do with the person didn't really need the hospital, but they were in a home and it was the middle of winter and they didn't have heat, things like that. So having some kind of funded case management for seniors may help with some of those issues.
Saw a hand up, yes?
Yes, and along those same lines, I'll submit that, I'm Susan Sigmund with the Direction Home Area Agency on Aging. And I would say that there is a lack of programs and services for the older adult that is near indigent. The state, the feds do have programs for that lower income older adult, but there is a lack of programs and services for the near indigent to remain in their community. You know, the literature shows that just a little bit of case management or a little bit of, you know, some Meals on Wheels or just those kinds of interventions can do much to keep people in their community, which is really would turn out to be a Medicaid diversion program, which is good.
Yes.
I'm Eleanor Marsh-Dormer. I'm the probate judge, and just to sort of perhaps wrap up some of the elder issues, I can tell you we get the viewpoint from maybe 3,000 feet about what's happening with the seniors, but the problem is only increasing. And while I think we have done a good job so far providing some resources in many areas, we in my court get people who are elderly who are being abused or neglected, and that's how we come into contact with them. What we don't have, and perhaps you could do a show on this and lead the way, is, you know, truly how we can coordinate this across. I mean, I'm delighted to see so many people with seniors' interests here because it's just growing. The baby boomers are growing. Their kids don't live here. They live everywhere else. Some of them are unable or unwilling, but many of them just aren't here. So you have people aging in place without the support, and you end up with these other kinds of disparate kinds of problems. If I can also step back and talk in another hat, I sit on the Children's Services Board, and we've had a benefits committee that was designed to look at community benefits, and in order to determine if we were providing community benefits, we had to assess community needs. And if you boil down the 4 subject areas, which were mental health, diabetes, infant mortality, and asthma, the common denominator is poverty. And so if you look at the health impact of poverty, it's going to cut across probably every single issue that we see here. And what did I say? Not Children's Services Board, Children's Hospital Board, sorry, Children's Services people. So although we deal with you all too, but the issue is really poverty. And so if you want to look at the root causes of why do you have some of these issues, I will put forth that one of the problems that our community faces, and perhaps all communities, is the concept of unplanned pregnancies for parents who are not able to meet the needs of that child. And then you just extrapolate. So that's a great television show, I think. Yeah. The effect of unplanned pregnancy for parents who are not prepared to care for that child, married, unmarried, it doesn't make any difference, I don't think. That, to me, is a hallmark issue that if we could address that downstream, you could address a lot of these other issues. Thank you.
Lori Lerner, Crossroads Hospice. One of the things that I see continually is people, seniors who are either have mental health issues or Alzheimer's disease, and there's no place for them because they cannot afford it. And so trying to get resources together and trying to support nursing homes and other places that are trying to care for these folks, it's very, very difficult.
Terry Dalton, Community Support Services, along with tying in on the mental health component, but I think it's really the lack of training of a lot of our medical professionals when it comes to psychiatric prescribing. You know, the general practitioner prescribes more psychiatric meds than psychiatrists, and yet the training is very minimal. So I think we see a lot of people use medicated, wrong medications, but they're on. And then when it comes to dementias, they end up not knowing how to treat that, or they don't understand the complication of the other meds make people appear psychotic, et cetera. So I think.
I'm sorry, can you clarify for me who is not trained in terms of prescribing psychiatric medications for?
General practitioners, internal medicine.
General medicine, okay.
Very little of their medical training actually is in the area of prescription medication for psychiatric.
So, and instead of referring to professionals, you're saying they're just taking it upon themselves to make a guess, or?
Right, because part of it, there is a shortage of psychiatrists that are available to do that, but also people come into the office and so they prescribe psychiatric medications to deal with something that could benefit from counseling, could, again, maybe some other medication would be better. So it's a lack of, or it's quick to get them out of their office because some of the same people come in time and time again, and so they're prescribing a medication, but maybe that's not the answer.
Cindy Strux from Summa Health System, Home Care and Hospice. I think the other issue is just medications in general, because I almost have to echo Susan. I mean, there is a disparity where people are right on the border, but if they're having to choose medications, and I think additionally the cost of medications fluctuate every day, and right now certainly in oncology there's a horrific, people are making decisions about treatment based on medication costs. So I think seniors are particularly vulnerable in the sense that there's very much a border between kind of affording the day-to-day things and affording medications, and they can't really budget very well because they change a lot. And then I think secondly, somewhat the complexity and over-prescribing of medications. So if you don't have good internal medicine, geriatrician, somebody looking at that, a lot of times it could be simplified and, reduced in many ways. So, sort of that case management, I know that's why certainly home-based services are really good in trying to help people make better decisions and focus on that. So that could be a huge challenge, I think, for seniors.
Yeah, the exclamation point of what Judge Stormer said, and that is, I'm with Kent State College of Public Health, that the social determinants, we call them social determinants, poverty, low educational attainment, those things, if we don't deal with those, we're never going to be able to deal with the downstream issues like chronic disease, which are lifestyle related in many cases, obesity and so on. And so we've got to figure out a way to deal with those social issues way upstream.
When you say we have to deal with that, who is
everybody here.
Yeah. Or health professionals, or?
I think the whole community, because none of us has figured out a solution to solve poverty or how to get folks to graduate from high school. And so it's going to take all of our thinking to figure those problems out.
If I can expand a little bit too, when we think about all the social ills that are out there and we throw in domestic violence and we throw in substance abuse and all the common problems, we know that especially the children and the adults in the home are traumatized, and we know that untreated trauma leads to physical health problems down the road. So catching it early in the cycle, I think, is just so important, but also sometimes very difficult.
I'm JB Poe. I'm an attorney with Community Legal Aid, and specifically I work in our HEAL program, which has a medical legal partnership with Akron Children's Hospital. So I'm looking at it from the lens of a poverty attorney. And I would say that amongst all the issues of poverty, the biggest one I see are housing conditions. And I say that because you have someone who lives in substandard housing where there might be lead in the home, there are rodents, roaches, there's other safety issues. And so you have parents who are missing work who are caring for children. You have children who are missing school because they're sick or because they're moving. Their education career is being constantly interrupted. You have the stress, then you have the economics, you have people that can't get transportation, and ultimately you end up with children who are, so I also do schoolwork, it's sometimes difficult to get the special education services or to have them assessed. You have kids with lead levels between 5 and 9. Research is showing that there's a U-curve and lower levels and really high levels and not the middle, but we're not quite equipped to handle the 5 to 9s where we are, like, the
What's
higher
really
end.
bad? What's a really bad lead level?
I mean, I haven't been doing it that long, but anything over 50 I've heard is not good. But you've got kids with like 200, and it's 6 points of lead level equals 1 IQ point. I mean, that's terrifying to me. You can't fix that.
Right. Who else? Yes. Oh, back to Sheila.
You know, I agree with the poverty, but I think we need to be careful not to just band-aid poverty as the total problem, because you have people that are in different economic situations that have mental illness, that have obesity, that have things that are not being said. I was in Geauga County at a meeting about a month ago, and they're talking about situational poverty. And I laughed because I said to someone, situational poverty is, as most of us in this room are 30 days away from bankruptcy. But in Geauga County, they tagged it situational poverty, and they've tied it to their food bank. People are coming in to get some help. Poverty has 3 different levels and many different faces. All of us in this room service the least among us, for lack of a better word. So when we talk about it, we're talking about a whole different dynamic. But when we talk about these problems, they're across the board. And I don't think we should lose sight of that. Our fundings here are all based upon the least among us. But we also need to encourage these services of help that are impacting the total community. You go to Bath and they've got problems. You come out to Stowe, they have problems. It's not just an urban or an Akron inner belt issue. And we have to be careful how we're labeling it. Yes, we are dealing with the ones with the most poverty and the most need. But you have people that are in, quote, situational poverty now. And it's impacting the community also.
Anyone want to add to what Sheila had to say about situational poverty? Yes, Carrie.
I just think that there's an issue with a lack of resources, whether it's economic resources to make healthy choices, whether it's health literacy, access to care, that several things can get in the way of someone making healthy choices. And it very often may be financial, but it can be so many more things than that added together can really result in health problems.
Other top issues that either haven't been mentioned or you want to add to what already has been said? Yes, Lynn?
Lynn Clark, I'm an attorney, and I also serve on the Board of Health. One of the major things, and I've been around for a while, and I look around this room, it's amazing how many agencies I've had to deal with over the years, because I do a lot of work with legal aid clients and poverty. And what always gets me is there's a lot of resources in this community, but it's a lack of coordination sometimes and a lack of cooperation, and the fiefdom and the silos that the agencies have, where we look and we say, and I've dealt with this, 2 agencies here today that are on my list because they've looked at me and said, your client needs to go over there. Send that client over there, and that agency says your client needs to go back to the first agency. because neither one of them really want to serve the difficult client. And, you know, I see that in a lot of areas where it's like, we can deal with this little issue, and then you've got this client going around and around and around and never really getting the cooperation, the coordination from the agency. Now I'm talking case management. I'm just talking, trying to sometimes just get the information. I know the county tried to do something about it a few years ago with, what was that computer system that was gonna, referral something or other, summer referrals or something like that.
Referral valet.
Referral valet, which was a total disaster, we should all admit it. But it doesn't mean we should stop making the effort to be sitting and I'm not talking community welfare forum where you get social workers meeting, I'm talking top staff, you know, working on specific issues, trying to coordinate programs. I'm off my soapbox.
Okay. We'll come back to it.
I'm Tom Craig with the Margaret Clark Morgan Foundation. And one of my observations has been that I've never seen so much change in healthcare, in the way things are paid for, in the way that systems are working, in the way that insurance has changed. And I see frustration on both the part of the patients and the people trying to get access to services, and the systems while they're in this change mode. It's hard to integrate services. It's hard to know how to position yourself so that organizations can be financially strong. And during all of this change, I think there might be great opportunity, but we also have to, like she was talking about, look at the systems and see how they interrelate and how they work together so that we can get some efficiencies and so forth. But the frustration really has been that people have been struggling to get access to services, especially I've seen this in mental health, and getting to the root of the problem, not just handling the symptom, but getting to the root of the problem that goes after what's the cause of the illness and what could be something that could help with the healing process rather than just treating the symptom. So.
Thank you. Gary?
Gary Lake from Akron Area YMCA. One of the new focuses that our association has taken on this year and for the future is type 2 diabetes. Obviously a very prevalent disease in today's society, but the interesting thing is those people who have been diagnosed is really the tip of the iceberg. The focus that we're trying to look at are the bottom part of that iceberg, the people who are maybe on the verge of getting into type 2 diabetes but haven't gotten that far yet, and what can we do as an association to help prevent those from getting into the disease process.
Okay, great. Donna?
I've agreed with everything everyone has said. There's just one group of people, our individuals in our community, that I worry about a lot, and those are the group that's now covered by insurance. Affordable care was wonderful. It gave folks that had access, but I think in some ways we've oversimplified it, because now you have individuals that have huge deductibles. You have individuals that are paying co-pays that they never paid before. They're paying $43 for their insulin. It used to be free. Because of this, now we have a difficult time getting patient assistance programs for some people, so that now that we can't get the free medications for individuals that we used to be able to get because you're supposed to have insurance. So I'm fearful as we move down this road, we're going to disassemble a safety net that's very used to taking care of people or treating them as individuals and not assuming because you have a card you're capable of getting everything you need. Because just as Ken mentioned and a few others, the social determinants play a much larger role in your ability to be able to navigate and know what you can do and not do. And I'm really fearful that in this community, if we're not careful, if you don't take the time to ask Mrs. Jones, does she have the $3 to buy the high blood pressure medicine, you're not going to get Mrs. Jones taking the high blood pressure medicine. And just one more thing, there's great research that says when folks fall on hard economic times, and if they have a high deductible, they skip their colonoscopies, they skip their mammograms, they skip things that are preventive in nature.
And we could end up years down the road feeling the effects and not even knowing it right now, thinking everyone's insured.
Christina.
Christina Hackinson from the Akron Metropolitan Housing Authority. I agree with everyone around the table, and really the population that we serve is one of the most vulnerable in our community. And we are seeing on the Housing Authority side, residents, the increase in the senior population and mental health disabilities, and trying to, as a housing provider, affordable housing provider, deal with those issues internally, and then extending our hands out to our partners and the resources available to bring them in to help our seniors live in the environment, or continue to live in the environment that they're comfortable in, home health care, those types of things. And unfortunately, in the affordable housing, going back to the safe sanitary, all of that, you know, unfortunately, the federal government is decreasing resources for us to continue to provide affordable housing or new affordable housing for those in most need to then have access to health care and all of the resources that they need. Just to give everybody a little bit of an idea, we have about 17,000 people on our wait list, and we serve over 20,000 individuals in Summit County. And so, you know, obviously.
17,000 on the wait list?
Yes, sir. So there just tells you that there's not enough affordable housing out there, which is the platform and obviously a very much basic need to assist in healthcare.
And I think just as an FYI, to put it in perspective, the living wage is what now, $15.01 or something, $14.01? So unless you make that much money, you can't rent a place. You can't find a place in Summit County to rent because you can't afford it. So that's two folks working a minimum wage job, putting their money together to try to rent someplace. Or co-sleeping, sofa surfing, whatever you want to call it. A lot of people living in one house.
It's also, yes, Reverend.
I think social isolation is a huge issue that underlies a lot of these health issues. The judge mentioned the older adults without any family support nearby, and I think we're such a mobile society that so many people are isolated. It's an irony. We're mobile, but we're isolated in our homes, and many people who are poor don't have access to transportation. And so people are just isolated, and I think that sense of psychological isolation is manifest in opiate addictions, drug abuse, mental health issues.
We'll take a couple more and we'll switch to the next topic.
Sandy Selby, Furnace Street Mission, is who just spoke.
Yes, I'll come back to you.
Amy Lee from Northeast Ohio Medical University. This is really an incredible group of people that you've brought together. You know, we have people from the hospitals, from public health, from community agencies, from law. And what they've been saying is interesting because you talk about the health-related issues, and not so much has been said about diseases so much, but about the living conditions, the living wage, the social determinants, the places that we live, work, and play. And it's so important, I think, as Ken said, for all of us to be working together and including some non-traditional partners as well. For example, I was looking at your list. I'm not sure I saw people from manufacturing or business. You know, there's a huge workforce there.
We couldn't find a room big enough to fit everyone.
No, but I have to applaud you for the number of people that you brought together. But we really do need to involve the entire village, everybody, to try to improve the community's health, because we all affect the conditions that people live, work, and play, worship, and pray. So I applaud your efforts, but we really do need to work together.
Thank you. And I have to thank Donna and her team from Summit Public Health for helping us pull a lot of these folks together. So it's a collaborative effort. For sure.
That's what we need to do, collaborate.
All right. One more comment from Karen, and we'll move on. Yes.
I'm Karen Talbot. I'm a consultant and also on the Summit County Public Health Board.
Uh-huh.
And one of the things we've talked about is coordination of services and those sorts of things. And we've got this concept now of medical homes. And I think that's a great idea, but one of the things that we're missing is all the wraparound services that go with those sorts of things that deal with preventive services and coordination of care and access to care, integration of behavioral health with physical health and those kinds of things. So I think we've got part of the picture there, but we need to think a little broader in terms of how we put all that together. And that's kind of been mentioned here, but this was kind of an overall comment to bring that all together.
For that. I want to remind everyone that, again, you have a worksheet in front of you. The third page of the little packet you have has all the questions that we're talking about today. So if there are any comments you want to make there that you weren't able to get into this first section, please make them there, and we'll be sure to pick them up before we leave here today. So let's move on to the second question today, which is, what's being done to address these issues? We've heard a lot about the social determinants that are really at the root cause of a lot of these health issues. We did hear about some specific diseases. We heard about diabetes. We heard about obesity, a couple of others. So what's being done and who's doing what? And a lot of you in this room are doing a lot of these programs. So what are you most proud of in your organization? So what's going on in the community? And then sort of with that question is there a common health agenda? To Amy's point, a lot of you represent different organizations that touch health in some way, or social services. Is there a common agenda that you're all working towards or working to address to have collective impact? So those two questions, what's being done and what kind of coordination, collaboration is happening in Summit, Medina, Portage counties to address these issues? I'll jump at once. I'll start with John, come back to you, Ken. Yes?
I'm John Sarris, formerly with Summit County Children's Services. It's been a real interest to me, the drug problem, the opiate problem mentioned earlier. And my experience, it's really a serious, it's destroying families left and right. And one of the interesting things is what's happening right next door in Portage County, where the county commissioners have just placed a new 0.25% sales tax in place in order to focus on the issue of opiate addiction. They had 8 overdoses in one day. And as a result of that, I think that really fired them up in terms of wanting to address the issue. Clearly, we have a very serious problem here in Summit County as well. And I don't know that an additional sales tax or any other such idea is appropriate. That would require a lot of thought and study. But my sense of it is that this is really hurting families. And when I say families, I'm talking about children. And we are concerned about the poverty issue, which is very much a legitimate basic, fundamental kind of a problem here that reaches into all of these areas. My sense of it is that this is really, really hurting children, and our present and future generations are really going to be very much injured by it.
I only know what's happening in my little slice of the world, but there are some very important things going on. The 3 hospitals in Summit County it's been written in the Akron Beacon Journal about them coming together to do a community health needs assessment, working with the health department and to identify what some priority issues are, and many of the folks here are part of that. And so collectively they're looking at what are the needs, and many of these same issues are coming up, and then they're developing action plans to do something about those things. The health department itself has got, they can tell you, they've got a whole boatload of programs, and they're really leading the way in many of these initiatives. And one of them is called this Accountable Care Community Initiative that I think has a great deal of potential. Dr. Gordon is involved from University of Akron, and Dr. Lee's involved from Neomed and health departments and the hospitals to take a look at, okay, we got all this panoply of health problems, and let's make ourselves accountable to the community for addressing them. And so all these agencies, and large institutions are trying to figure out what can we all do with our own resources and capacity to address some of these issues. So I think there is a lot going on in this community. And frankly, the collaboration I see between the hospitals, who we all think they're all competitors with one another, is amazing. and the fact that they're bringing in academia and they're bringing in public health. So it's.
Are you aware? Can you speak to how far along that needs assessment is? And
well, the needs
did it
assessment
just start, or are we somewhere in the middle of the process?
It's done. That's done. They're now looking to do another one because of the Affordable Care Act. Hospitals have to do this every 3 years, and so they're now looking to the next 3-year cycle. But they're deep into way past the needs assessment and deep into what are we going to do about it.
Can I just add something? I don't know about the adult system, but in the children's system, and Ken is part of the children's hospital system, one of the first things that they've done, which I think is important for all of us, as I'm sitting thinking, how can I get all the people that have talked about senior issues together for the issues that we see in my court? But the big thing is data. And one of the things they've done at Children's, they've actually now created databases so they can start tracking diabetic children, asthmatic children, tracking infant mortality issues, and they're starting to use, now they have data, which they had in the mental health side, suicide being one of the largest issues for children, and by that just people under 18, they're actually collecting the information. So once you have the data, and I don't have the data for my group, when I talk about senior issues, I can only tell you what I see, which is just the people that rise up to the problem area. But I do see a community of collaboration. But to get the data on the people who are the isolated people that Dr. Selby points out, or the people who are cutting their meds in half or missing the meds, I don't know. And perhaps that would be a first step. And I don't know if Donna can you magically produce all this data of the seniors? Do you have that? But I mean, that probably is the first thing that we can start to do, which is to how do you empiricize the topics that we're discussing, because if you don't know where you start, it's hard to tell where you're going, right?
Terry.
I think one of the things community support services for the last almost 8 years now has been providing integrated health care, behavioral health care, and through the Margaret Clark Morgan Foundation, the ADM board, and jointly with the University of Akron and Neomed, we've been serving as a training site as well. So I think there's some effort there to reduce that 25 years earlier death than the average population. So I think there is that coordination of care. With the health district now, we're doing nutritionists or dietitian that's coming in. We've got podiatry services. We've got HIV testing, and I'm thinking dental services that we now got. So I think there's a start in that process. But I think one of the other challenges that we have, and it maybe probably addresses more your last question, has to do with the fact that we talk about integrated healthcare, but our funding streams are all different. So there's all sorts of challenges on the funding stream. We've got the regulations at the federal level, and so it really is not going to really get integrated healthcare until we look at the state, local, and federal level to make sure that those dollars are all coming together. And somebody talked about silos before. I think Lynn did, talking about the silos. We still have those silos. We've got the different levies that are funded different services. So I think that challenge we have in that cooperation amongst all of us is who's funding it, because it's clearly still is not an integrated funding stream.
Yeah, Jamie.
I spoke a little bit about our medical legal partnership with Akron Children's Hospital, but there's also, we were part of a SUMA centering program, so it helped. There are two programs, a high-risk maternity unit and then an opiate-addicted unit, or an opiate-addicted centering program, where the ladies who came in had to be in treatment. They were seen by a dentist, legal aid, CSB was there. There was a lot of safe sleep and other education, and anecdotally, the babies had longer gestation, born with a higher birth rate. Moms got to take their kids home and they were still clean. And so some of the impact, I guess, was decreased, which was, and I know that program is still ongoing. For our part, when someone calls in and they are screened in, so that we can do something for them, one of the questions that they're asked is everyone in your household, do they have health insurance? And if they don't, we try to see if we can get them qualified for Medicaid, and if not, to see whether or not they are eligible for the marketplace.
You'll turn over here, Tanya.
So I won't go into any detail, but I do want
sorry, introduce yourself and who you're with.
Okay, I'm Tanya Block. I'm the Director of Community Health here at the Health District. But I think people are being a little bit modest. There's an awful lot going on with regard to responses to some of the things that was mentioned earlier, and so I'm just going to throw a few things out there, and if anyone wants to speak to it, they can. For example, our ADM board established an opiate task force several years ago when we first began to see the problem with the number of children in the neonatal unit at Children's Hospital. Since that time, they've invested a significant amount of resources into, like Donna mentioned, the Project Dawn initiative that we have going. They've invested an awful lot in making sure that we have a really good sense of what's going on with our youth in the community by investing in a survey that included 15 of our 17 school districts, ages K to 12. And they've also been partnering with us on this needle exchange program that we're looking at. Judge Stormer has done an incredible job with regard to providing support to our indigent seniors by establishing and leading our volunteer guardianship program. And that was really at a low cost, but in terms of partnership, she got several of the other public systems around the table to contribute to that as well. Our Department of Job and Family Services, in response to the abuse and neglect that's happening in our community, has partnered with the Health District and a lot of other agencies to try and create a community response to some of the challenges that we're seeing. So I know we have a really long way to go, but there's an awful lot happening here, and I think we've just got a modest group. Yeah, because they do it every day. It doesn't feel like something new, but we've got a lot going on in response to the work.
Well, the floodgates are open. The hands are flying up.
Yeah.
Let's go to folks we haven't heard from yet, and we'll come back to David, go ahead.
I'm David Jennings. I work for the Public Library System. And one of the things that I think is most encouraging and different over the last few years is that I think that there's recognition that if we're really going to attack chronic lifestyle-related illness, we have to involve parts of our community beyond the healthcare systems, as evidenced by the folks around this room. You know, Metro, Goodwill, Terry. I mean, AMHA. There's people all over this room that I think 10 years ago wouldn't have been invited. And that's an indication that if we're really going to get to behavioral change, that is the key thing for lifestyle illness. That's what's really encouraging about this group. So that was my comment.
I'm Lynn Blinko from Akron General Edwin Shaw Rehab, and I'd also like to talk about how the ADM board has really supported the opiate problem in the community by funding programs at Edwin Shaw to start a medication-assisted treatment program there. We were historically abstinence-based, and we started that 3 years ago. We saw over 400 people in the last 2 years for opiate addiction, and we have one physician, Ann DeFranja. We're missing physicians. We have a problem with physicians who are willing to get their DEA waiver so that we can prescribe Suboxone. Doctors' hands are tied to 100 patients if they're in the private community, if they're not part of an opiate treatment facility. Those are some of the things that challenge us. The other things that challenge us are having enough counselors available to provide the treatment that is required. So those are some of the things, like if we could, work with the University of Akron, Kent State, to try to get more people into that and to erase the stigma of the heroin user. I think that is a big problem for some of the physicians. They don't want to deal with those types of individuals, but this crosses all economic, geographic lines. We're being asked to come in conjunction with the Summit County, we're doing health department, the Dawn clinics, and we're getting requests to give out 75 kits in Hudson, and they want us to come to Green and do 50 kits. Those are the types of things that communities really need, and we just need to get more doctors on board. And health professionals, as well as community professionals that are willing to assist in the endeavor. But the ADM has been amazing with this, and I really give a lot of credit to what they've done.
Jeffrey.
Sure. Jeff Snell, I'm with Summit County Public Health. I'm also a lawyer in my day job. And Summit County has become really the resource, the health department has really become the resource for that data that Judge Stormer talked about. That Quality of Life project has generated a lot of data that you're all aware of that can tell you a lot about the community and where we were and where we are and how we continue to change. That's been a commitment of Russ Pry and the county and the health department, And that's really a niche that we have created at the health department that I'm really proud of. An outgrowth of that, Tanya briefly talked about, and in my practice I do a lot of probate, and that leads to what Judge Stormer talked about. Now, when there's a senior in trouble, Jobs and Family Services sends a social worker, we send a representative from the Sheriff's Department, we send somebody from the Building Department, and we go into their house. Now we can have a coordinated approach to what does that person need? How can we address their immediate needs? How do we address their long-term needs? How do we deal with a guardianship? How do we deal with handling that person? Those are the kind of programs that can really help us. So when we talk about outcomes, data is very important. We have so much of that data, and all of the partners around this table have helped contribute to that. But then that leads to how do we improve it? And we've found programs of coordination. We have a small county in the sense that a lot of partners work together to advance the cause. And I'm glad that everybody's here, but that's, I think, an outcome of our community that's really important.
What else is going on to address some of these issues? Karen.
Donna mentioned the Social Services Advisory Board, which was created by legislation in Summit County, and it's got several initiatives dealing with many of the things that are mentioned today. Reverend Selby is one of the co-chairs of the Health and Human Services Committee for that and covers a lot of those initiatives. We actually met today as a board, and one of the things that we talked about and endorsed was, and it will be through Summit County Public Health, is looking more into single parenting and infant mortality. But those are the kinds of things that we're seeing and being able to bring together as important and impacting in the community. And it was mentioned earlier, but I also want to say hats off to Judge Stormer for this volunteer guardianship program for indigent seniors. That's very important and has long been needed in our community, and congratulations to her for stepping up to help make that possible, and more folks are needed to participate in that.
Any other oh, sorry. Someone over here? Yes.
I think it's more of a comment, but one of the things that I think we're seeing at least more in healthcare practitioners, and it would be so beneficial for more students and professionals who are just becoming into the community to hear this kind of collaboration, because I think what's happening is, we're kind of training a new set of practitioners to be a lot more collaborative, a lot more team-based, and really sort of aware of the decisions people need to make. And so often the first point of contact for people's issues is health care, but then maybe we're not always so aware of all the other issues that are impacting them. So I think, as we train healthcare professionals, and I think we're doing a much better job, I think that's what maybe, the new healthcare agenda is kind of getting to. So not just thinking about that individual patient encounter, but what is that population that I'm taking care of? And I think you see that advancing, and I think that would be an incredible opportunity for to kind of hear that, because you kind of get it one-on-one, but you don't have an opportunity to see this kind of interaction.
Greta, we haven't heard from you, and then Giselle.
Directly following up on your comment on
Sorry
training
to interrupt
practitioners.
you. Can you introduce yourself?
Greta Lax. I'm with the Akron Region Interprofessional AHEC. AHEC is a federal program, and I'm hosted at the University of Akron, serving Summit and Portage counties. Following up on your information on training practitioners, I don't know if anyone has mentioned yet the Summit Bridges Out of Poverty initiative. Has that been spoken about at all? With the Bridges Out of Poverty initiative, we're trying to address poverty a couple of different ways. So one of them, of course, is working with folks who are coming out of generational poverty, and helping them kind of to better understand the difference between their experience of the world and then the very middle class way that most of our world is run. There's the piece that educates those of us who might not come from generational poverty that need to better understand our clients and patients coming from there. And one of the things that I've been able to do, so a lot of us here in the county that have gone through that training are able to take that and use that to train both, the folks that we work with, but also our practitioners. So, for example, I know some of the folks working with United Way to do that. Akron Children's Hospital is working to become a Bridges Out of Poverty organization so that they're training their staff on how to better understand and work with their clients who are coming out of poverty. I have the opportunity, working primarily with health profession students, to do that training. So I touch every senior nursing student before they leave the University of Akron and talk to them about a better understanding of generational poverty in general, how that can better help them work with their clients or their patients coming from generational poverty. I'll be working with neomed students. I'll touch every first-year medicine and pharmacy student come in to talk to them about what that means. So hopefully that is some of the stuff. And we also have the opportunity to educate our practitioners and our educators, our faculty members who are working with clients. So I think there are a lot of little ways, and there are many, many people working with that Bridges Collaborative across our county, helping to build a shared vocabulary and understanding to help us better work with and cross those lines of socioeconomic status.
I'm Giselle Jones, and I work for a Jewish Family Service. And a part of the responsibilities I've taken on and been a part of is the Senior Independent Living Coalition, which actually came out of the Quality of Life Initiative. And it's just been a wonderful collaborative for me because I've been able to work with people like Susan and all of the agencies that are really interested in working with seniors and improving the life and quality of life for seniors. So I think that's been a wonderful initiative here in Akron. And as a part of that, we've been able to actually do and work with Season and do other collaborative events for seniors to go out into their homes, to do assessments to make sure that they are able to get some of those community resources that they don't know about so that they can get a good quality of life in their homes. So I just think the Senior Independent Living Coalition is one of the best things that have come out of that quality of life initiative.
Tom first, and then Lisa.
So to address the health and wellness and disease prevention aspect of things in our county, we've at Medina Hospital we've developed a program called Healthy Medina County, which is a collaborative of Medina Hospital, the city employees, the city leaders, the schools, and businesses to identify health needs in the area. This also educates employees, parents, and students, and provides programs to improve the health, wellness, and also promote disease prevention. As a result, we've seen improved metrics in health risk assessments. We've seen less absenteeism in the workplace and in schools, and we've also had decrease in employees and employer premiums for their health premiums. And as this rolls out, this has been a consistent finding. It's a little bit easier in Medina County. It's considerably smaller than Summit County, but it can still be done.
Lisa.
As part of the University of Akron, I am one of the nurse practitioners in our community clinic. It is one of the few nurse practitioner-run programs in the state. And going off of what you said and also Greta, we offer an interprofessional program, whereas we're seeing patients, we are bringing in students from each of the different disciplines to collaborate with each other, to know what each other are doing in order to take care of the patient. The other thing that we are very concerned about is the breakdown of the safety net that Donna spoke of. And in doing that, we are partnering with many of the different projects in Summit County. Better Birth Outcome, we have 2 providers at Community Support Services, but being a part of community projects and taking that into the care of our patients.
For folks who haven't talked, Jerry?
Sure. I'm Jerry Craig with the Summit County ADM Board, and just want to talk a little bit about the heroin problem. We see heroin become a community problem in every community. It used to be looked at as an urban issue. And I think that while that's been, it's horrible that it's spread so much, it has had a unlikely impact on our communities in the sense that it's opened up some political will to fund things that hadn't been funded in the past. And along with the perfect storm of Medicaid expansion that occurred in Ohio, we've been able to reinvest funds that had formerly been used for treatment into recovery support services. In the old days, anything beyond acute care for somebody with a heroin addiction would be considered to be outside of the normal course of medical care. So now we're looking at this rather than an acute care model, we're looking at it as a chronic care model that requires recovery support services like housing, employment services, and other types of supports that will help people build some social connection So while it's been, the stigma of that I think has been lifted because so many people have lost someone to a heroin addiction, we look at heroin and it's a community-wide problem, and not one system can really address it effectively, and that's why we formed the Opiate Task Force. And the Opiate Task Force has really been able to engage our federal legislators. It's been engaged our state legislators. It's engaged a broad spectrum of the community, from criminal justice to health care to our social services. And it's also allowed us to build awareness into the community. We've been able to, for the first time, to be able to spend funds on prevention services, and that's why we did, in partnership with Public Health, the Youth Risk Behavior Survey, so that we could see what sort of problems impact our community and how can we focus and target our prevention programs to make the largest impact. And so we're just beginning to do those things, and that will allow us then to measure the outcome of those programs. Legislatively, now there's been more of a will to address the IMD exclusion for people in residential addiction treatment. So now we've got large residential addiction treatment programs that don't qualify to bill Medicaid, and under legislation that's been introduced now, perhaps that opportunity might present itself. So there are a lot of opportunities that have been presented because of this horrible affliction, and mostly I think because it's affected every community and it's not just been looked at as an urban issue.
I want to mention we have, I think, 2 representatives on behalf of elected officials. I think Catherine and Amelia, right? You work on behalf of elected officials?
No, I am elected official.
Oh, you are yourself one. I'm sorry. I don't have the list in front of me. I apologize. But do either of you want to speak? I mean, you get around the state, you get around various jurisdictions. Do you want to speak to anything that's been said today with respect to what's happening in a positive sense in terms of collaborative activities to address some of these health issues?
Well, thank you. I'm Amelia Sykes, State Representative. I represent 34th House District here in Akron. I think that what Mr. Craig said was very true about, especially relating to the opiate addiction and the issue that we've had legislatively at the State House. We have invested a lot more money in mental health and addiction services than have ever been previously considered or thought about. It is unfortunate that it had to spread before people started to take notice about it, but I guess we can take what we can get and use it to our benefit how we have it now. I will say one of the major issues in the State House, and something I've been working on, is the infant mortality. I've been in contact with some of you at the table already about some things that I'm working on with the Department of Medicaid. There is some funding coming into the areas of the state that have the highest infant mortality rate. There's about $13 million appropriation that will be coming into 2 zip codes, not 13,000, not all 13 million is coming into these 2 zip codes. That would be great, but we have to spread it across the state. But there's that program that's going to be coming in by way of community health workers and making sure that there are people who can really connect with the women who are pregnant, before they're pregnant, when they're pregnant, after they're pregnant, and making sure that they're getting connected to all of you around this table. There's also some funding coming from the Commission on Minority Health to help the infant mortality rate to implement a pathway hub. That will be a competitive grant, so I hope that you all are talking to each other about how you're going to get those hubs going, because it's possible that Akron does not get that money, but I really hope that we can come together, and I'm sure we can, to make sure we can draw down that funding. That'll be about $1 million coming from the state. Otherwise, it's just a little bit of a battle to make sure that prevention and wellness is on the forefront instead of treatment, which is expensive, it's costly. Similar to a comment I heard about the productivity that they're working on in Medina and having more people come to work. That's because when you put that money in the beginning of that person's health span in their life, and you can really see what happens on the tail end. So hopefully we start to spend some more money on prevention and wellness rather than just treatment and those things that are really costly. Thank you.
I don't have anything new to add, but I just find that these groups are beneficial in keeping our bosses informed. Ginger represents Congresswoman Marcia Fudge, and Leah represents Senator Brown, so we're happy to be here. Thanks.
We're going to move on to our last question. We have about 10 minutes left, and then we'll wrap up. The last question is, what can IdeaStream do to help? As Kit mentioned earlier, a lot of our senior managers, our content managers are here today. A lot of our health reporters and producers are here. You can see them with their notepads writing furiously for everything you're saying, and what they'll be following up with, I'm sure, with many of you to get story ideas and all sorts of things. And IdeaStream through its platform reaches 4 million people a month with our programming. So we do have a broad reach throughout Northeast Ohio. So what can we do to help? What can we do to help some of these things that we've discussed today? My face went directly to Lynn, so go ahead.
About a year ago, that as Summit County Board of Health was setting priority programs, priority goals, and that one of the priority goals we set was public education. You know, that we need to do more education, not just collaboration, coordination, that, but education. I deal with so many folks in my practice. I would say, why don't you call? They're like, oh, I didn't know they did that. And you know, I'm very glad it's the IdeaStream here because I know a lot of folks listen to it. It's the only TV station I get on my TV, believe it or not. So I watch it. I know a lot of people who pay attention to it and listen to the video, but we need to do more education of the public on all of these issues and all the resources. So.
The Margaret Clark Morgan Foundation is a regional foundation, so we serve the 18 counties of Northeast Ohio. And what I've noticed is that coverage for health issues and other really important local issues varies quite a bit. The Mahoning Valley has 3 local television stations. Cleveland has their own television stations. Akron does not have that, and in many ways there's a disparity in reporting. We really depend a lot on Cleveland for our news and for our information, and I think that there's a need for cross-county learning and learning what other people are doing in other places, but there's a real need in Medina, Portage, Summit counties for local news and local reporting so that we know what is available in our own community. We know how we can better work together, and exercises like town hall meetings like this can be a catalyst to cause a lot of those things to happen, but they happen very infrequently as guided by the media. Most of the time it's been happening by the ADM board or the health department, or our foundation has pulled together people, the NeoMed has pulled together people, the library has pulled together people. So we've had to do a lot of that kind of work ourselves, and then that message does not necessarily reach the general public or those who are isolated and can only see things on television or on the radio. So, and then much of the local radio that we do get isn't credible in the sense of real good information about what's happening, that information that you can trust. And so PBS and IdeaStream has a reputation for being a very credible source, but I feel that there could be a greater emphasis on the southern region that you serve.
Thank you for that. Karen?
Advocacy and awareness certainly are big parts of this and kind of tie into what's already been said. One of the things that wasn't mentioned earlier was end-of-life care. And we as a community have tried to educate the population about that in terms of the quality of life that goes along with end-of-life care that's possible, as well as the cost-effectiveness of that. When the Medicare program first offered that benefit, they were able to demonstrate that end-of-life services really can cost about 1/8 the cost of those not getting appropriate end-of-life services, where appropriate choices are being made and educated sources are being made. That's the kind of thing that I think IdeaStream could help educate people about, and they're going to come out with a better quality of life, and you're going to have more cost effectiveness and all the kinds of things that go along with that. But we do have that initiative in Summit County, and I'm sure the other counties may have that as well, but that's something that IdeaStream could definitely help with.
Tell the story, right? So you have the opportunity to tell the story of the collaborations and what's working and how we can do a better job. When we talk about the elderly and the collaboration that we have here in Summit County, there are success stories. We only hear about the negative piece of it. Let's start talking about the success stories and bringing attention to those. And then when you do that, you can talk about what the need is. For elderly that are abused, one elderly person gets reported, there are 5 who are not.
Mm-hmm.
So those 5 people are still out there with nobody identifying them and linking them. So you can tell that story.
I think getting people to
understand what they can do. Judge Stormer's tort, she's looking for people that can be guardians. I know Mature Services manages the Retired Senior Volunteer Program that is targeting needs in the community, so we find volunteers for those things. So there's definitely things that if people knew there was ways that they could make a difference, and you guys were telling that story and told them how to connect, that there's opportunities for people to give back to the society.
Amy Lee from Northeast Ohio Medical University. I absolutely agree with the fact that the media is wonderful at telling stories. I also buy into what everybody else said about needing data. So the stories that can be told should be backed up by data. But I, a while ago, read a book by Carrie Patterson called Influencer, and it told a really interesting story of a Latino TV station and how they told, almost in a soap opera fashion, stories of, and they picked up social issues such as domestic violence and health literacy, and they were able to bring awareness to the public. Recently, if you've been following the news, we've heard how nationally a video or individual stories have pushed legislators to propose policy as well. So both at the policy level and the public level, the media is a very powerful source to be able to both bring awareness and even push policy.
I saw Lori's hand, then we'll come back to Judd. Lori?
I was just going to piggyback on what Karen said about end-of-life care. There's other components too. There's many people in this room who are working on a project trying to get the message out about signing advance directives and those kinds of things, so we don't have people who don't want resuscitated being taken out of the nursing home and what have you, and starting the conversation. And that's also part of the end-of-life care that I think needs to be, if you guys could do a story on it, it would be fabulous.
And we could give you the whole package on advanced directives, and I'm not making that up. I mean, seriously.
Judge, we have some executive producer
I
positions.
know, and whoever you
if
all
you'd like
are,
to apply.
April 16th is National Healthcare Day, and if you think that that's a good idea, I mean, this is something we've been working on collaboratively as well as sort of independently. The reason I care is because if people don't tell the doctors what they want, I have to make the decision. And I'm trying to avoid that, to be honest. I think that should not be my decision. But it is a great little one-show thing with lots of, we've got all the infos right here. It would be very easy, producers. It would be easy.
Healthcare decision that-
And it would be, it's very important.
To an audience.
This is our set right here?
This is our set.
Okay.
This is set.
Awesome.
Yes.
That's great. Ken and then Sheila.
Yeah, I think a lot of us struggle with trying to reach the younger audience. I know we do. You know, adolescents and young adults and all that. And you all, you know, you understand, you know, web technology and social media.
We do the Twitters. And
you do all that stuff, yeah. And so figuring out creative ways to get some of these health messages to those audiences.
When you say that, do you mean just the messages, you know, hey, you can be more healthy, or make them more aware of the issues, both?
Both, but also even like some of our students who understand this stuff better than I do created little phone apps that are, you know, health reminders or little games or things like that that get young people aware of the fact that the way they live and the choices they make impact their health. And so maybe you guys have some expertise.
I'm going to piggyback on what Karen said about volunteering. I respect each and every one of you in this room, and you do a tremendous job. I've been fortunate enough to sit on the board where some things that I do help to contribute, but you all are the ones that are really out here doing it. And I think if you could do something that would encourage mentoring, talking about the needs. Someone talked to me about the Guardian program, and I've been talking to other people about it because I can see the need. But I think that if you, as a credible venue, talked about these are the things that are going on in the community, these are the good things that the people are talking about should be highlighted, but we could use some more help. Kids learn to read from K to 3. If they don't know how to read by the time they enter the 4th grade, by the 6th grade, they're starting to show the behavioral problems that you see, the other problems that may not have been diagnosed, where going into a school tutoring with kids once a week, you'd be surprised at the difference that makes, but a lot of people don't know where to start. Where someone like your organization in a broader sense could reach out. And I think the mentoring and volunteering highlight it.
David, close the
I was
comments
late,
for-
so I apologize if this was already discussed, but in terms of what Idea Stream could focus on, I think that if we're going to really have an impact on community health, we got to spend a lot more time talking about what we eat and drink. That's so key. I think it's the biggest challenge we have, is behavioral change, to change the way what we eat, what we drink. So many of these things are related to that. That's an opportunity for Idea Stream.
Okay, maybe one more, because Mr. Gordon hasn't spoken.
Hi, so I'm Dave Gordon from the University of Akron, and since I'm one of the newcomers here, you can direct your tomatoes and eggs at me. Say, forget this guy. I certainly agree with a lot of things that have been said. You've heard listing of all the different issues we have in the community. You've heard some of a listing of all the different resources we have in this community. You've heard, you know, the issues of, gee, maybe we don't collaborate and work as well. I think perhaps a good idea for us would be if you hold us accountable in terms of saying, okay, we heard this, give us a scorecard, and come back, say, in a year and sort of say, how has this group, you know, made a difference a year from now? I think holding us accountable to some degree would help us to be able to say, okay, are we basically going to continue with the same panoply of things that we're doing and not making any progress really moving the needle gauge, or are we serious about moving the needle gauge? So I think that would help. I mean, I've used this for my own self personally. You know, I used to be somewhat larger than I am, and, you know, someone asked me, you know, what's the best way to ask Dave Gordon to reduce? Best way is to put him in charge of a weight reduction program, you know, and he's out there visible, he's got to do something, you know, to make it happen. So I would say, you know, generate a scorecard on us and hold us accountable.
Well, these are all terrific ideas. I'm going to give a round of applause for all.